I wanted to cover just a few common questions that I get about finasteride on a typical day of practice. The first is, how should it be stored? Like any medication, keeping it out of direct sunlight and avoiding extremes of temperature is important. Unfortunately, a lot of people think that a bathroom is a great place to store it, but because of the temperature and humidity there, it can cause some issues with the viability of the drug. Also, keep in mind that this is not safe for children or pets, and women, also, particularly those trying to conceive, should not be handling these. It's category X, which means it can cause birth defects. Although the tablets are coated and generally considered safe when they're not broken, the standard advice is that women should never touch finasteride tablets. That's just a blanket statement. I've seen some off-label use for women being treated with this. However, that is completely at the discretion of the prescribing physician and not typically FDA approved. How soon should a person experience results? Typically, the life cycle of hair, as I tell people, is that it's very slow. It can take at least 3 to 4 months for the results to start to appear, and it's not at all uncommon for shedding to occur. Basically, the theory is that the weaker hairs are being pushed out as the hair follicle is sort of revitalized, and that can and does happen for a lot of people, which can be alarming. Also, it doesn't work for everybody. The stats show that up to 1 in 10 of every men don't respond to this. So keep that in mind as you're considering what approach to take for hair loss. Obviously, hair loss is a personal journey, a personal decision, and consulting with your physician about what option might be best for your unique health needs and past history is critical. Definitely encourage the willy-nilly approach of just ordering things randomly from other countries and hoping for the best. That certainly is a recipe for putting your health potentially at risk. Last is, how does it actually work? Well, finasteride, it's a 5-alpha reductase inhibitor. It actually blocks the conversion of testosterone into dihydrotestosterone. And we know that male pattern baldness, or the medical word is androgenic alopecia, is not actually caused by testosterone, but it's a DHT. The DHT has its effects at the hair follicles, and it causes those to shrink, and it helps impair their ability to create new hairs. This is what we call miniaturization of hairs, and the way the finasteride works is to try to keep it in its native form. So typically in the US, we're using 1 milligram dose for hair loss. Some are using higher doses. Also has an indication for prostate enlargement. Obviously, all this has to be coordinated with your doctor. Please see the previous video regarding PSA, prostate antigen testing, and the use of finasteride and other 5-alpha reductase inhibitors. So I hope you found that helpful. If you have questions, reach out to your doctor and have open, honest discussion about what option is best for you.